patients always ask, and it may be, okay, you're sticking a fiber optic into me. There's light, are there downsides or safety precautions or anything you've seen in the research that you've done?
We have never seen, in the years of working with Dr. Weber and the team and training other physicians in clinics and doing it in our own practice, everywhere from intravenous applications to direct injection to a tumor area, to injections to a joint, to topical or laser acupoint topical applications. To this date, knock on wood, and honestly, scientifically, I will say we have not seen a negative side effect. We actually did a small study for doing an intravenous IV study during this whole COVID period of time. We started with a group of about 5 to 10 patients with an intravenous IV laser protocol. We did 5 days of intravenous laser, and we started with only 5 people, and then we increased to about 10 or 15. And we're working on getting up to about 50 or 60 to finish off some of the data collection that we need. But we needed some updated information of specific laboratories before and specific laboratory testing after the receipt of laser therapy, right? So we did these 5 days, consecutive days of IV laser. We did every color spectrum that we have available. We did red, green, yellow, blue, and ultraviolet. The only one we did not do in this specific case was the intravenous infrared. And it was really impressive. We chose people who were not particularly sick, no one that had any specific disease or ailment, just people that every day feel kind of low energy. They really don't have a specific diagnosis, not high or low blood pressure. They're just, don't feel great, but they're not particularly dealing with anything. And after those 5 days, we wanted to see how long the benefits would last, if there were benefits that showed, and also how long the laboratories would actually show those changes. And this is where, honestly, even after 8, 9, 10 years of doing this, I don't know how long it's been now, I still kind of sit there in awe because it amazes me every time. Every one of those people, all 5 of them, had an increased inflammatory markers. And I can go to specific markers. They were C-reactive protein, fibrinogen, sedimentation rate. Every single one of them had them on the high end, right? Before the IV laser. And at least 3 of them had increased liver enzymes, and 2 had very, very high cholesterol, but not the good kind. And I was actually very impressed because at the end of the 5 days, on day number 6, we repeated the same labs. All inflammatory markers went down to normal range, and the 3 patients that had the increased liver enzymes went down into normal range. We retested in day 15, and they still held with the same result. Now, they were eating a fairly healthy diet, but they really didn't change too much of what they were doing. These are people working in the healthcare industry, but not specifically dealing with anything, right? So that was we did not see any negative side effect. Even white blood cell counts improved, hemoglobin levels improved. We only saw, and this is just clinical data, apart from, subjective, they noted feeling more energy, they slept better, they had improved flexibility in their muscle fibers. They didn't feel as tired in the morning when they got up. They didn't have to have that boost of coffee. They just did it because they liked it. Those kind of things. So I that was kind of a little bit of a long answer, but I want to give you actual data as well. We have not seen a negative side effect. The only thing, obviously, is you don't put the laser straight in your eye and stare at it. Mm-hmm. Other than that, we have not seen it. I'm impressed also with Lyme disease. One of the biggest issues we have with Lyme is the Herx reactions from many treatments we receive. And we've worked with some of the, leading experts in Lyme disease and integrating photodynamic therapy into their practice with what they do. And they can even reduce the dosing of what they're using because the laser is potentiating the effect. And yellow laser enhances serotonin and dopamine in the body. It also enhances vitamin D absorption. One of the biggest issues with many Lyme patients is they either cannot take vitamin D. Many of us know why they can't absorb it. Or even in cancer, we're chronically low. None of us go out in the sun. So we have noticed an improvement by just applying the intravenous yellow laser in those markers. And when we Herx, we will put the patient on IV yellow laser. We have found that it opens the detox pathways and can cut out the Herx reaction for people. And I'm sorry, but that's amazing because I have not seen that. Lyme patients get, especially when they're that sick, I understand that firsthand. A lot of times there's not much you can do to calm that down, especially when you're in a reaction or a flood from medication or treatments, whether it's natural or pharmaceutical. And that's one thing that really does improve the effect of that side. That's it, that issue.
I could say we've seen that at our center because we have a large population of Lyme disease patients here in the Northeast and from around the world. Really, Lyme isn't a localized disease anymore. And one of the hardest parts is always the detoxification. And when you go through antimicrobials, that's when you have this kill off, this die off, and to minimize that as much as possible through the use of combining the IVs with the laser at the same time, using the yellow and all those others to really minimize. And it's been a really great adjunct therapy to all those IVs that patients are going to have to go through, and really make it a much easier process to get rid of Borrelia and all co-infections in the body. So, and it's great to hear that, of course, there are no dangers or really true side effects that you see with so many other therapies, conventionally based at least.